Hi, my name is James Cravens. I worked at the Kansas City plant, the Honeywell facility, and I am a patient of United Energy Workers Healthcare. I have been a IBEW electrician since 1974. I worked outside construction for 14 years, and then I went inside the Honeywell facility from 1988 till 2014. It was Bendix. Well, before that, I think it was Pratt & Whitney during the end of the Second World War. The Bendix plant, then it was Allied Signal, GE, and then Honeywell. So it went under several names. They say that they made electronic components for nuclear weapons. That was their statement. The kind of work that I did was from general construction, from running conduits, pulling wires, cables. Control wiring is big there because a lot of things are automatic and automated. And so that was the scope of my work, constructing new, repairing old projects the entire time I was there, from small projects that could last an hour to projects that would last several months. Currently, I have lung issues, and there's days that I have shortness of breath, but I'm thankful that I haven't crossed over, because over the years we saw a lot of people with the same identical issues, and the end game was horrible. So I've been told what they found. There was a lot of dangerous departments in that facility, but as an electrician, we didn't understand the severity of it, because, you know, as an electrician, I know not to touch this, not to touch that, kill the power here, but on things that are invisible, we had no idea of what we were exposed to at all. I noticed that there was time I would have bad equilibrium walking through the plant, and if I had like a tool bag, I actually would just sometimes have to stop and kind of lean on the wall because my world was spinning. But when you go into a machining department where there's a fog in the air, literally a fog, and you work in there, well, I just didn't attribute it to anything. You know, I'm having a kind of a bad respiratory day, and really I didn't understand the severity of it until I was told that they found something, and that was last year. So then, as I recall all the episodes, I just shook my head, and now it all makes sense, because we were working plating areas, all kind of chemicals that only a mad scientist would understand. I had a daughter that got sick, and she was on her way to medical school. She was enrolled in medical school. Coming from a family that I was the first one to graduate from high school. And so my daughter's enrolled in college, which was just huge for us. And she got the rarest disease, where the doctors in Kansas City put her on a hotline, and they had us go to Johns Hopkins. And they said they didn't know what it was, because no one else in the world had this particular diagnosis. She was a kid that fought in the lounge. She would say, "Daddy, when you come home," I would always sit by her fireplace. She would run and get my coffee and take off my boots, the strings off her. I said, "Baby, you don't have to do that." She said, "Yeah, you tired." And she was a joker. She said, "Yeah, so I can get in the lounge." I said, "Okay." But I know now that we transported something back to her. Beautiful girl, beautiful. Never gave us an ounce of trouble. We know that rarity had to come from what I brought home on my boots and shoes, my clothes. I know that. I believe that with all my heart. I was diagnosed with the pneumoconiosis and the pneumofibrosis, and they linked my colon cancer, my very first colon screen, to the asbestos fibers that were flying through the air, you know, just because of the ventilation systems. As for me, I had shortness of breath, get winded, Hearing loss in one ear is almost gone. The impairment doctor told me to have him file a claim for that. The worst kind of arthritis imaginable. And there's high blood pressure. They're attributing it consequentially connected to that. My eye issues where they replaced my tear duct because it ruined and it wouldn't drain, so it would swell up my head like someone hit me with a baseball bat. So they finally took it out in surgery and then they replaced it. So I've had some medical issues that were just kind of bizarre. I learned about the program for sick and affected workers after I got the call back that we found something. And then the United Energy workers was referred from one of the workers on his staff that they would give me a call. And my wife, being a social worker, she said, that is what you want, is you want the home health care. And I'm so glad I signed up for it. I know a lot of you guys and gals have been frightened by the primary diagnosis, and I get that. But the home health care is priceless. You definitely want that and that benefit there. And I encourage everyone to get with UEW and let them handle your health care for you.
If you or a loved one worked at a Department of Energy facility, call us today at 866-802-2101. Discover the benefits and compensation available to former DOE workers. Let us help you get the care and support you deserve.